The question on the minds of many is, what will school look like in the fall due to the coronavirus? And how is the virus affecting students in the first place? PJ Walker finds out.
It's a kind of a mystery.
That's Jerry Grant, a retired educator and also a grandparent. She says she hopes North Dakota will be in a good enough place to allow her grandchildren back into school this fall.
I think it really needs to be driven by what the statistics are. I don't think there's an easy answer to it. Kids do well when they're in school with a variety of activities and different people to work with.
But that may be easier said than done. When the pandemic began, it quickly became clear that senior citizens with underlying health conditions are most at risk for severe symptoms of COVID-19. But when it comes to kids, there are still questions.
It still looks different in a child, so nobody really wants to pull the trigger to say, yeah, kids can go back to school, and then next thing you know, they have an outbreak in 2-year-olds that have COVID.
According to the Mayo Clinic, kids' symptoms of COVID-19 tend to be mild, similar to the common cold, if they have symptoms at all. Dr. Faria Salim says other symptoms are possible too, and kids can still transfer the virus easily.
Whereas some kids, which may be outliers, are getting swollen hands and feet, and they're getting like the respiratory symptoms and the lung involvement.
As for getting back to school, data from Europe could be cause for optimism here in the U.S. According to a report from Reuters, students in Denmark are now back in school, and their return did not lead to an increase in infections. And while we don't know yet what the state has planned for North Dakota, grandparents like Jerry Grant say she hopes the decision is made with a lot of thought.
I worry about them because I think there's so much that's unknown about it and how it impacts children.
Reporting in Minot for KX News, I'm PJ Walker.
205 children between the ages of 0 and 9 have tested positive. The state says 179 of those children have recovered. And we expect to hear an update from Governor Burgum about their re-entry to schools sometime this month. In today's Your Health First, they flew off